We have been conducting small research in the community, in two communities adopted by our hospital in the city of Indore, Nai Basti and Valmiki Nagar. Several of master's students of Nursing College of Jaipur have been doing studies on educating these patients, these people in community on burn prevention and safety with fire and the first aid after burns. They then had a questionnaire evaluating how much they have understood and how much this education has helped them to change their behavior. And we were quite surprised to find out that it has not changed their behavior very significantly. Then the master's student wanted to come and evaluate our work here, and so she conducted a study about the incidence of pediatric burns in these two communities following the education impact. And the incidence then was about 20 children in 42 families that were questioned had minor burns during last 1 month. We decided then, based on their discussion, that most burns were happening in the morning at home among very small children, 0 to 4 years, because the mother was very busy during the morning time with her domestic chores and she didn't have much time to pay attention to the child's safety. And we discussed with the mothers if they would be happy to have something that stopped the child to come to the kitchen area or the area where she was cooking, and the child remained in some other area safely away from the hot objects and the hot oven or the hot stove. And the mothers were very happy and they were willing to accept something that was offered by way of helping them with this option. So the survey was conducted as to what is their need, and we found that several homes had 2 rooms and there were about 10 homes that had only single room apartment. Single room meaning that was the room where they cooked, ate, slept, washed, everything, every activity was done in one room. And so the intervention was designed based on their needs. If there were 2 room apartments, then we gave them a barrier which was about 2.5 feet tall and occupied the lower part of the door between the 2 rooms. So the child was kept away from the kitchen while the mother was cooking by putting this barrier on. This barrier was a wooden block which fitted in the doorway by aluminium channel. This is a 2-room house of a community in New Basti in Indore, and this child is one of the members of the family of 4. The other child has gone to school. Mother, when she cooks, this is the kitchen and this is the door between the living room and the kitchen. She would use a barrier like this so that the child remains outside and cannot come inside while she's cooking. They have found this very useful and they have devised their own innovations. What we gave them was an aluminium channel on the 2 sides and a wooden partition that would slide in the aluminium channel, but because of the inclined nature of this pillar, the aluminum channel did not work and it came off. And so that barrier is not being used, and they have replaced it with a little longer barrier, and which is more effective. What is good about this barrier is that they have accepted the principle of using a barrier to keep this child safe outside the kitchen while the cooking is going on. In a room, single room apartment, the mothers were provided with a playpen which was based on their needs. It was designed as a 2 feet by 2.5 feet rectangular iron material playpen with a little wooden base which could have been covered by some cloth by the mother. And then we explained to them when to use this, that this must be used when the cooking is going on, or when the hot liquids are stored on the floor level. The child must be kept away. This playpen was designed and made locally and was given with this idea that children in one-room apartment where a barrier cannot be used should be kept in a safe place, away from the hot liquids and the fire while the mother is cooking. This child with his toys, or he can even have some company, some neighbors' children can be sitting in this, and two families can benefit from one playpen, or they have huge family and some more children. And when we ask the mother, she says she's very happy having the playpen because this definitely is functional and very useful. After 1 month, the questionnaire was done again, which revealed that the incidence of burns is very significantly reduced. There were only 2 incidents of small burns, and those happened in the homes where the barrier was somehow not functioning because of some mechanical reason. And so they kept it away and the child sustained small burns. But otherwise the mothers were very happy and they were able to prevent everyday fear of the child running into the hot liquid or coming close to the flame, and they were very relaxed, very happy to have this intervention, and they were very happily using it.